I'm here in Calgary and I'm joined in Edmonton by the Chief Medical Officer for Health, Dr. Hinshaw, to provide an update on COVID-19 in Alberta. First, I want to wish all Albertans a Happy New Year. 2022 may not be starting out as we had hoped for or envisioned, but despite our ongoing challenges with COVID, we do have good reasons to be thankful and optimistic about the year ahead, especially as Alberta continues to lead Canada in economic growth, and we see lots of good news on the jobs front and economic diversification. But just as we've wrapped up the holidays, I want to recognize Alberta's fantastic healthcare workers, the first responders and frontline workers who continue to give up time with their families to care for Albertans. We see the sacrifices that you are making, and everyone is truly grateful for your dedication, especially those of you who worked over the holidays and put in extra shifts. I also want to recognize the many Albertans who made the effort to limit their New Year's celebrations over the holidays, over the past weekend in particular. I know that none of us wanted to be ushering in a new year by having to postpone, cancel, or limit much anticipated gatherings with friends and family members. I know it's been disappointing, but the actions that we take now are critical to protect our healthcare system from the impact of this highly transmissible Omicron variant of COVID-19. While Omicron is less severe at an individual level, even a small percentage of a very large number of people requiring hospital care can put our healthcare system under real pressure. Today, we are reporting more than 30,000 active cases, but that's defined as people who have tested positive on a PCR test. But we know that the number is actually much higher with a positivity rate of 30%. And that's why we do expect to see hospitalizations rise in the weeks ahead. It's also why Alberta Health and AHS is doing everything they can to prepare our health system for the impact of this wave. I'm calling on the Government of Canada to help us out with that by taking immediate action to authorize the use of Pfizer's COVID antiviral pill, Paxlovid, that was recently approved for emergency use in both Europe and the United States and other jurisdictions. We need to use every tool at our disposal, and this can be a helpful tool for our physicians and frontline staff. This drug can be used for the treatment of mild to moderate COVID-19 in anyone that's 12 years of age and over who is at a high risk for progression to serious situations like hospitalization. The approval and subsequent procurement of this drug could help to save lives. Now, before Christmas, we announced additional public health measures to better protect our province, and this included reducing capacity by 50% for venues participating in the restriction exemption program that seat more than 1,000 people. It also included setting limits to those seated at a table, no mingling between tables, no interactive activities like dancing or billiards at hospitality businesses. And last week, we responded to the concerns of school boards and extended the holiday break for students from K to 12 until January the 10th. This allows schools and educators more time to plan for students to return safely to learning. We know how important in-person learning is to the overall health, well-being, and development of children and adolescent youth. Earlier in the pandemic, I said that every day our kids can remain in class is a small victory, and I still believe that. We have to do everything we can to allow for safe in-classroom instruction. It's in the best interest of children, and we clearly see a growing consensus amongst experts, pediatricians, and child mental health experts around Canada and the world in that way. We're hearing the calls from child advocacy groups like the Children's Health Coalition and pediatricians about the need to prioritize a safe return to classroom instruction as quickly as we can. Now, there are three simple things that every Albertan can do to protect themselves and help relieve the pressure on our healthcare system. Number one, get vaccinated. And if you are vaccinated, get your booster. As of January the 3rd, about one out of every three Albertans 18 years of age or older have now received a third dose. And that's good news. It's progress. It puts Alberta towards the top of the Canadian provinces for booster dose uptake. But we need to keep pushing that number higher. We have nearly 190,000 booked appointments over the next month. In addition, we know that the vast majority of people will walk in to get their shots. And we're going to be making that easier by reestablishing high flow through clinics like we did in earlier waves of vaccination. I'm encouraged to see these numbers rising. Every percentage increase in the number of doses in arms reduces the chance of hospitalization and helps protect our healthcare system. I understand that in the United Kingdom, which is well ahead of us on the Omicron wave, that 91% of COVID patients have not received a booster shot. That is to say, 91% of the people in British hospitals, at least in intensive care, with COVID as a result of Omicron, did not receive a booster shot. And here in Alberta, I'm told we have no COVID patients currently, people who are at least primarily in hospital for COVID, who have received a booster shot. And indeed, we are at 70% of those in ICU are unvaccinated. So the 70% who are unvaccinated come from the 10% of the population that is unvaccinated. So while the vast majority of Albertans are now getting or awaiting their booster shot, if you still need a second dose of the vaccine or you haven't yet gotten your first, I urge you to book your shot today. So far, Albertans have received more than 7.7 million doses of the vaccines, and I want to thank each and every one of those Albertans for doing their part. Getting vaccinated provides the greatest protection from becoming seriously ill from the virus and overwhelming our hospitals. The second thing you can do to help to protect our healthcare system from Omicron is to limit the number of interpersonal contacts that you have. Please avoid large gatherings for the time being. If you're going to have a get-together, make it as small as possible. Catch up with friends and family over Zoom instead of in person, and work from home if you can. I know many Albertans have done exactly that over the holiday season, holding fewer and smaller Christmas and New Year's gatherings, and I thank them for making those sacrifices. But we need to keep at it as Omicron continues to surge here as it is in dozens of countries around the world. We need to break transmission chains, and that means reducing opportunities for the virus to spread. And finally, we recommend that you take a rapid test when appropriate. I'm pleased to see the great response that Albertans have had to the rapid test kits we've been rolling out. Our pharmacy partners and Alberta Health Services sites did a great job of getting the kits into the hands of Albertans. To date, hundreds of locations across the province have received more than 800,000 kits. That works out to 4 million tests, and that's in addition to several million that we'd already distributed to folks in the community like long-term care centers, the homeless shelters, and others dealing with vulnerable people. I want to reassure Albertans that more of these kits are on the way. We have, as a province, as a provincial government, procured about 10 million additional rapid tests. The first million arrived last week, and 3 million are scheduled to arrive every week through to mid-January. This will add to the about 4 million rapid tests for which we have confirmed shipping dates from the federal government. And so in total, nearly 15 million of these rapid antigen tests will arrive in Alberta between now and the end of January and will be made available across the province for all Albertans to use. Our first priority will be getting those in to the schools so that parents can use them with children if they're showing any signs of symptoms. So that will be 4.3 million tests next week for K-12 students, with an additional 4.3 million to follow later in January. So please get your booster and cut your contacts. Thank you, and with that, I will now turn the microphone over to Dr. Hinshaw for her COVID update.
Thank you, Premier, and good afternoon, everyone. Today is my first update in the new year, a time to reflect and look forward. And before getting to the numbers today, I want to share some of my reflections. The last 2 years have been some of the most challenging times that most of us have ever lived through. Words like relentless, unfair, heartbreaking, and exhausting only scratch the surface. Those who have lost loved ones, those who have lost businesses, those who have lost their health, those who have lost jobs are only some of the losses that COVID has inflicted on us. Into that hard reality, Omicron has arrived as a perfect storm of increased transmissibility immune escape from both previous infection and 2 doses of vaccine, and enough early signs of reduced severity at an individual level to be tempting to not take seriously. It is completely understandable to be so tired of everything we have been through in the last 2 years that we feel like we're powerless in the face of the current wave. I want to be clear that we are not powerless, and we must take this wave seriously. While 2 doses of vaccine may not provide the kind of protection against infection it previously did, it still gives good protection against severe outcomes, and even better, we have 3rd doses available that strengthen protection against both infection and severe outcomes. We have knowledge of the impact of continuous masking and staying home if we feel even a little sick, and we must make all efforts proactively to limit the number of in-person interactions that happen on a daily basis. I know it can be hard to understand why we need to take action when risk seems to be individually lower with Omicron. We need look no further than Ontario's current experience to understand why. With case counts far exceeding anything we have ever seen before, the sheer volume of cases means that daily hospitalizations are beginning to escalate. The population risk is high, even as the individual risk is lower, and Ontario is only a little more than a week ahead of us. The actions we are all taking now are critical. We continue to monitor the experiences of other jurisdictions, and it is too soon to know exactly how Omicron will impact Alberta. However, given how fast Omicron is spreading, now is the time for each of us to make changes that impact the case counts and therefore the downstream flow into hospitals. When we think of protecting our health system, we need to think about the people who make up that system. Our frontline healthcare workers have experienced the trauma of repeated waves over the past 2 years, and each wave takes an additional toll. Our actions now will make a substantial difference to the resilience and capacity of our healthcare system, not just in the next few weeks, but in the long term, as burnout and fatigue are very real and will not be gone overnight. I believe it is critical to use every tool at our disposal right now to protect the people and system we rely on to take care of us when we are sick from any cause. Turning to the numbers, we have resumed our regular weekday reporting, and today I will provide numbers for January 31st, December 31st to January 3rd. These numbers will also be posted to alberta.ca shortly. On December 31st, 4,570 new cases of COVID-19 were identified out of 12,700 tests. On January 1st, we identified approximately 3,323 new cases and completed about 9,450 tests. On January 2nd, around 2,059 new cases were identified out of about 7,100 tests, and yesterday we had 3,013 new cases identified out of about 8,200 tests. Our positivity rate over the past 4 days has ranged from around 28% to 36%. This is the highest positivity rate we've seen with any variant since the pandemic began. We know Omicron is highly transmissible. Right now, more than 1 out of every 3 people getting a PCR test are testing positive for COVID-19 with higher rates in Edmonton and Calgary. If you're feeling unwell, it's quite likely because of the Omicron variant. And this means it's critical to stay home until you're feeling better, even if you have a test with a negative result. For those without access to rapid tests, it is still possible to book a PCR test, although even a negative PCR test does not change the need to stay home until you're feeling better. Currently, there are 436 people in hospital with COVID-19, including 61 in the ICU. Sadly, since December 28th, 12 deaths related to COVID-19 have been reported to Alberta Health. I must also sadly report that one of these deaths has been confirmed to be in a child under the age of 18. As we announced in October, in the case of anyone under 18, we do not report a death until we've completed a thorough review and confirmed that COVID was either a direct or contributing cause. To balance protecting the privacy of the family with the public disclosure on this case, we can report the child was in the age range of 5 to 9 years old and had a complex medical condition. However, we will not be providing any additional identifying details. The presence of a medical condition does not take away from the grief or tragedy of this loss. I extend my deepest sympathies to this family and to anyone who is grieving the loss of a loved one, no matter the cause. While Omicron is shown to be less severe than other variants, each death is an unfortunate reminder that its effects can still be serious and even deadly for some. As the numbers show, the Omicron variant continues to spread rapidly across the province. This has been the case in other provinces, and like other provinces, Alberta has made changes to our legal isolation requirements. Last week, as you know, we announced that the isolation time for fully vaccinated Albertans who tested positive for COVID-19 was reduced from 10 days down to 5, as long as their symptoms had resolved by that point. We made this change based on evidence showing that fully immunized people are infectious for shorter periods of time. This is a cautious adjustment. If an individual is symptomatic or becomes symptomatic during that 5-day period, they must continue to isolate until all their symptoms have resolved. To further reduce any potential to infect others, that individual must then wear a mask when they're around other people for an additional 5 days after their isolation ends, and none of the usual exceptions apply for these 5 days. For example, someone who's fully vaccinated and gets symptoms and tests positive for COVID would be able to leave isolation if they're feeling better by day 5 from the start of their symptoms. However, that individual must not eat or drink, for example, in public places for these 5 days and must keep their mask on at all times when outside their home for that time period. I want to make perfectly clear that this reduction in isolation time applies only to people who have received at least a complete primary vaccine series and whose symptoms have resolved by 5 days. However, this change does not apply to residents of continuing care facilities, no matter their vaccination status. To help prevent spread among these individuals who are at a higher risk of severe outcomes from COVID-19, all residents will still need to isolate for a minimum of 10 days or until their symptoms resolve, whichever is longer. The 10 days will begin on the first day they have symptoms or from the day an asymptomatic resident takes a COVID-19 test that indicates they have COVID-19. Any resident in isolation must remain at the facility and in their room during this period of time. The details of this public health order on isolation, including guidance for continuing care facilities and which businesses or services may be eligible for exceptions, is now available online at alberta.ca. We continue to watch Omicron very closely, and I will continue to make recommendations on what I believe to be the most prudent course of action. We cannot know with certainty what our future holds, but I do know beyond the shadow of a doubt that we will all be best served by acting in the next several weeks with the good of our communities in mind. It can be hard to do this, but the resilience of our healthcare system and healthcare providers is on the line. Each one of us matters, and our collective efforts have never been more important. Thank you, and I'm happy to take questions.
Thank you, Premier and Dr. Hinshaw. With that, we'll go to the queue. Operator, can you please put through your first caller?
Thank you. The first caller is David Staples, Edmonton Journal.
Hi, Dr. Hinshaw. Thanks for taking my call. I'm curious about the numbers of people in hospital and in ICU with COVID right now. Is there a breakdown on how many of those people have Omicron and how many of them have the Delta variant or some other variant other than Omicron? And also, do we know how many of those people are in hospital primarily because of COVID or just that they have a positive COVID test, maybe asymptomatic?
Thank you. Those are important questions, and we are working to update our reporting to be able to distinguish between those who may be admitted for another reason and have COVID as an incidental diagnosis versus those who are being admitted for treatment of their COVID infection or of another condition that has been made worse because of the COVID infection. However, that process is a bit complex, so we do not have that worked out yet, and so we will be providing that information As soon as we're able to do that, we are working with other provinces to ensure that we're using the same definitions and that that type of reporting is consistent. With respect to how many in hospital have Omicron versus Delta, first of all, we don't necessarily know the variant type of everyone in hospital at this point in time, partly because it does take a little while to be able to run the genetic screening on confirmed cases. And there are some cases where that genetic screening isn't possible. So we won't have 100% confirmation of how many are Delta versus Omicron, and there is a bit of a lag. That's something that I can take away and see if we can provide that information today with respect to the Delta Omicron breakdown. I don't have those numbers at my fingertips.
Do you have a follow-up, David?
Yes. So we have moved the quarantine from 10 days to 5 days for people who are asymptomatic at the end of the 5-day period. In South Africa, my understanding is they've taken a further step where if you're asymptomatic, there's no quarantine at all. And they did this because for a couple of reasons. It sounds like mainly, though, to keep their hospitals going and keep essential workers in place if they're asymptomatic but are testing positive. And also because there's so many cases, they were just hammering. They were locking down some people, but not everyone with the disease, so they thought it was ineffective. Have we given any thought to that kind of move toward if you're asymptomatic, there's no quarantine at all?
We know that people who are asymptomatic can still transmit COVID, and we have had instances where that has happened with Omicron to date. So it's important that when we look at the adjustments we may need to make to preserve essential services, that we are not broadening that approach so far as to potentially increase risk. As I mentioned earlier, it is really important that we take Omicron seriously. And so we do need to make sure that we're minimizing onward spread from people who are known to have an infection. Having said that, we also recognize that the maintenance of essential services, including healthcare and other services, is going to be a challenge in the coming month given the widespread that we're seeing. And so that's why we've built into the isolation order an exception process that highlights those who are at the lowest risk of passing infection on to others down to the highest risk, as well as criteria for businesses such as, for example, a water treatment plant or another business or service where keeping that operational is absolutely critical to public health and safety. And so that's built into the current isolation order for those very exceptional times where an essential service needs to be maintained by potentially bringing someone back. In that case, that individual would be able to attend their workplace. However, they would still need to remain on isolation for any other purpose for the duration of the time period appropriate to their status based on symptoms, based on vaccination status, and other considerations that are built into that order.
Thank you, David and Dr. Hinshaw. Operator, can you please put through our next caller?
Thank you. Adam Toy, Global News.
Yes, thanks for taking my questions. First question that I had for you was just wondering why, given the, I believe this is a record active case count that we've had, and previously you've said there are no, that current testing regime only captures a fraction of the actual cases in place, but wondering why, given this record number of active cases we have, and given how places, and like you quoted in Ontario, have seen upticks in hospitalizations. Wondering why there has been no further public health orders or measures being put into place today.
We continue to monitor the situation very closely. We'll be meeting tomorrow again as the Cabinet COVID Committee. We had 2 meetings last week to review the latest data, both here across Canada and around the world. We do know that Omicron is a significantly different variant than the earlier ones that we encountered in terms of the speed of it and the ease of its spread, but also it being much less severe on an individual basis. Of course, we are all concerned that even a very small fraction of people being hospitalized on a huge number of people who've been infected can put unacceptable pressure on the healthcare system. Those are the factors that we will be keeping a very close eye on as we continue to monitor that situation. I'll remind you that we have had I think, stringent public health measures in place since the first week of September, which were further enhanced just before Christmas. We, as in the past, we regard restrictions as a last and limited resort, given the damaging effect that restrictions have on the broader health of society. We've seen that damage particularly experienced by young people, by youth and adolescents. We've seen it manifest in record numbers, I believe, of opioid overdoses, for example. And so we need to take on board the broader social health as we balance these things. I will note that there is, I think, some encouraging data out of foreign jurisdictions. Obviously, South Africa, now some people say it's quite a different population in terms of its relative youth, but it was also very low, had very low levels of vaccination. But Denmark was the first European country to go steeply into an Omicron wave, which they began about 7 weeks ago. And as of today, Denmark is reporting, with a population of 6 million people, larger than Alberta, and huge Omicron spread, they're so far reporting about 50 people on ventilators and about 800 people altogether in hospital with COVID. Similarly, we've seen ventilator use in intensive care come down in the City of London, which was hit just about as early as Denmark. Now, there are many other factors we're looking at. It's likely that early Omicron spread has affected younger parts of the population more quickly, and we have to keep a very close eye on the trends of hospitalization with seniors. There was an encouraging study out of South Africa on that last week, but again, a lot of this data is still too early, which is why we're monitoring the situation very closely, and if we determine that more action is necessary, we will take it.
You have a follow-up, Adam?
Yes, a question for Dr. Hinshaw. Wondering about pediatric cases in Alberta, notwithstanding the one that you announced earlier here. Wondering if we're seeing an increase in pediatric cases or an increase in severity in pediatric cases here in the province. I know Omicron has really only been a force here in the province for just over, or it's been in the province for just over a month, but wondering if we're seeing any emerging data regarding children.
The earliest case growth was very high in those who were 20 to 39 years old. And so in the earliest case growth within the first few weeks while Omicron was dominant, we didn't necessarily see a surge in the younger age group. We've seen that reported in other countries. And of course, with the release and data over the weekend, I haven't had time to look at the age-specific breakdown from the weekend yet. We have seen in other countries that because younger children are the disproportionately unvaccinated group, since 5 to 11-year-olds have only recently become eligible and those under 5 are not eligible, that other countries have reported them making up a large proportion of cases. That's not, again, been something that we've seen in Alberta to date. However, it is extremely early and too early to know exactly how this will unfold here.
Thank you, Adam. Operator, can you please put through our next caller?
Jeremy Thompson, CTV.
Yeah, just first question here for Premier Kenney. With schools, the holiday break being extended here, a lot of daycare and day home providers are feeling a lot more pressure as parents, send their kids there, and they're not particularly feeling very supported at the moment by the government. Wondering what sort of relief or help you might be able to provide daycares at this time.
Yeah, thanks for the good question. And we acknowledge the very important role that they provide and have how they've adapted to difficult circumstances throughout COVID and have been really a very helpful part of helping parents cope with the changes in school schedules, for example. I know that support has been provided in the past in terms of, for example, access to personal protective equipment, including masks and hand sanitizer, that many workers in that area were included in the emergency worker benefit top-up in the past. I will speak to the Minister of Children's Services, Minister Schultz, tomorrow at our Cabinet COVID Committee to see if additional support is necessary at this time. the schools are scheduled to go back into in-classroom instruction next Monday. So hopefully this will be just a short-term pressure that some of them are facing for a few days this week. And as I say, if additional support is necessary, one thing that we can do is look at, for example, the Provincial Operations Centre, which distributes PPE, including masks across the province. We can make sure that they are continuing to provide that to daycares and day homes.
And do you have a follow-up, Jeremy?
I do, and so, Premier, I'm just sort of wondering what the, how would you describe your government's strategy for battling the fifth wave here? We know, after the fourth wave, you came out and apologized for the way that was handled. What is the strategy now? What are you doing right now to hopefully prevent an apology, 2 months from now?
Well, the biggest problem we had going into the fourth wave was being relatively under-vaccinated compared to the rest of Canada, and that made us vulnerable. Going into that at 77% of the adult population vaccinated. We're now up to 90% with the first dose, 86% with the second dose. And the single most effective part of the strategy is right here. It's to get your booster. As I say, we don't apparently have a single person in ICU right now who's had a booster shot, who has COVID. So this is the superpower that people can get. It's free. It's available anywhere across the province. We are expanding access to it. We're doing everything we can to make it easy and convenient for people to get that hugely important protection against the Omicron variant. Of course, the public health measures that are already in place, the single most important thing is for people to actually follow the measures that are already in place. Ultimately, in a big, complicated, free society of 4.5 million people, it's going to be up to the voluntary efforts of the overall population to cut social contact. That is why we have these measures in place. It's why we've asked people to cut their contact at least in half to slow transmission. Now, one thing we can see right across the world, every jurisdiction that has been hit by Omicron, it looks, regardless of what their policies are, some of them with virtually no public health measures, others with lockdown style measures, in every one of those jurisdictions, it goes up like a hockey stick, straight up. So that is the reality. So the other part of the strategy is to ensure that the healthcare system is prepared for this. And in that respect, I think the emerging data suggests that the threat to our healthcare system that Omicron may pose is not as much situated in intensive care as previous variants, such as Delta, but much more likely to present in other parts of the healthcare system, in emergency wards and ambulatory care. So we need to be sure that we are addressing the kind of pressure that this variant will impose, which is different. What we are seeing in places like South Africa, Denmark, and the United Kingdom, and various U.S. jurisdictions is quite a significantly lower percentage of these cases that end up in intensive care, particularly with ventilation, but overall a larger number of cases presenting. So that is something that we'll be focusing on as a government and working with the AHS to ensure that they're prepared for the different challenge that this variant appears to be presenting to health systems around the world.
Thank you, Premier. Operator, can you please put through our next caller?
Thank you, Don Bray, Calgary Herald.
Yes, question for Dr. Hinshaw. Dr. Hinshaw, given the number of cases, are you contemplating taking any new measures to the Cabinet Committee that we might hear about soon?
I continue to provide advice to the Cabinet Committee and have provided advice for, as you know, during the entire pandemic. The decisions that are made by the committee are the purview of elected officials, and I will continue to provide my recommendations.
Thank you.
Don, do you have a follow-up?
Yes, for the Premier. Premier, we've lost a big project in Calgary, as I'm sure you're aware. What do you make of it? The event center has been canceled right at the moment when it was supposed to start building, and we haven't heard a reaction from you. Could you give it to us, please?
I'm very disappointed that the city of Calgary decided to change the deal at the last minute. When construction was ready to proceed, this is something that had been subject to negotiation for years. And I understand the owners group pointed out that we are facing now pretty significant construction inflation. The city's response to that was to add even more costs and more delays. So I think that's really regrettable. Let me tell you, Dawn, that before Christmas, I spent about 4 days in back-to-back Zoom meetings with CEOs of major Canadian companies on Bay Street and elsewhere, promoting investment in Alberta. And one of the big selling advantages was our high quality of life and our relatively low cost of living. And one of the aspects of that I featured in that selling pitch was all of the great new amenities being built here, the modernization of the Glenbow Museum, in which we are investing, the upgrades to the Arts Commons, as well as, of course, the Event Centre, other exciting things happening at the Stampede. So I do think that's part of the broader package of an effort to get Calgary's mojo back, to get people moving here and to bring investment here. It's to have world-class facilities. I was encouraged that the city and the owners group had come to an agreement, and I think it's very regrettable that the city decided at the last minute to change the parameters. I just hope that they can reconsider and get shovels in the ground as soon as possible. The project itself will help to create jobs which are much needed in this city.
Thank you, Premier. We have time for 3 more. Operator, can you please put through our next caller?
Jennifer Lee, CBC.
Hi, thanks for taking my question. This question is for Dr. Hinshaw. I'm wondering if Alberta is considering shortening that interval that it's recommending between first and second doses for kids 5 to 11, that interval of 8 weeks, given, what you're seeing with the spread of Omicron and the fact kids are set to return to school next week.
I've had extensive conversations with colleagues across the country, and I know that the National Advisory Committee on Immunization deliberated this when they looked at the interval and whether or not they would advise shortening it. The debate between the fact that Omicron is spreading fast right now and the knowledge that the 8-week interval provides the best protection, both at that moment of the second dose, but also longer term, as well as minimizing the risk of adverse events. So again, as I've been discussing this with colleagues across the country, we continue to look to the National Advisory Committee for their recommendations, which is at this point in time still to go with a recommended 8-week interval. We do specify, of course, that if a child is immune compromised or if there's other extenuating circumstances, that parents can have a discussion with their healthcare provider, but continue to recommend in general that 8-week interval be maintained, and that is the interval that I'm choosing for my children.
And Jennifer, do you have a follow-up?
I do, thanks. We've spoken with parents who are opting to do this. So what would your message be to folks out there who, are very worried about sending their kids back to school next week and who are weighing the risks and benefits there that you talked about with shortening that interval since, AHS is allowing folks to go ahead with it? What would your message be to people who are worried and weighing those risks and benefits?
It's a very difficult challenge. I guess I would say that, again, this is something that my colleagues and I across the country do not take lightly, that we have discussed this, and again, that the experts who make up the National Advisory Committee on Immunization are also looking at all of those pros and cons, and the recommendation does continue to be 8 weeks. However, again, understand if some parents are considering all of the context in their own personal family for that particular child. And so that is why, again, if there's a very specific situation that parents are able to have that conversation with their healthcare provider. But ultimately, I guess I would say that the general recommendation continues to be that protection is important not just right now, but for the long term, which is why we do continue to recommend that 8-week interval. And as I mentioned, it is a decision that I've made for my own children.
Thank you, Dr. Hinshaw. Operator, can you please put through our second last caller?
Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. Premier, I'm wondering how confident you are that schools will be returning to the classroom next week, if this putting it off further is on the agenda of the COVID Cabinet Committee tomorrow.
No, it's not. We are very determined to ensure the reentry of schools for in-classroom instruction on the schedule on January 10th. It is so critically important for kids. There will be challenges. There will be teachers and staff who are on isolation because of the widespread nature of this variant. But I think there has been a significant change in the consensus across certainly North America, many jurisdictions that had suspended schools for in-classroom instruction for much of the past 20 months have realized in retrospect that it was a mistake. I'll just give you the example of New York City, which was one of the first and where you saw some of the longest closures for in-classroom instruction. And you'll see the comments from the mayor-elect yesterday about his determination to ensure that the schools operate. That's the case broadly across Europe. It has been certainly consistent in Western Canada. We have sought as much as possible to keep schools open for in-classroom instruction. The science is in now. We know that in-class transmission has not been a significant problem. We know that that COVID poses a radically lower risk to the health of children than it does to adults. We know many of the key tactics to help operate classrooms safely. We're investing significantly in that. Over $40 million has been spent by Alberta school boards, supported by Alberta's government, on improving their ventilation and air quality systems. We are providing upwards of 10 million medical-grade masks for students and staff. We are making rapid test kits available to the schools, of course, for every student in class, to give their parents an additional tool that they can use. There are a wide range of protocols in place for school boards to operate schools safely. So there will be challenges. There's no doubt about that. But we want to do everything we possibly can to keep the schools operating for in-classroom instruction, because we believe it's in the best interests of the overall well-being of those children.
Carrie, do you have a follow-up?
Yes, I do. Thank you for that, Premier. I'm not sure if this is for Dr. Hinshaw or the Premier, but the numbers that you guys gave on hospitalization show that the admission rate is up 25% since December 29th. How much of this is a concern, and at what point do you have to take action if you keep seeing that type of growth?
Well, first of all, I would point out that we're at 48 COVID patients in intensive care right now. As you know, that has been the key pressure point in our system. And I believe that's the lowest it has been, if I'm not mistaken, since August. It's down over the last week and down over the last 2 weeks. And that would seem to reflect a trend that we have seen in other jurisdictions where hit earlier than we have been by Omicron, where there appears to be a relatively modest impact on intensive care. But I think where we can expect to see significant growth is in the non-intensive care part of the hospital system. And that's something that we'll be monitoring very closely as we go forward.
Thank you, Premier. Operator, can you please put through our final caller?
Thank you. Charlotte Dumoulin, Radio-Canada.
Oui, bonjour, Monsieur le Premier ministre. Ma première question, c'est au sujet des médecins et des infirmières à qui on parle cette semaine, qui se disent vraiment démoralisés par tout ce qui se passe. Ils sentent qu'ils n'ont pas eu pause entre la 4e et la 5e vague. Il y a une pénurie importante de personnel dans les hôpitaux, donc ils sont vraiment fatigués. Et en Alberta, on sait que ce qui s'est passé au Québec et en Ontario, ça risque de nous arriver. Donc, quel est le plan pour faire face aux cas d'hospitalisation qui vont possiblement augmenter? Est-ce qu'on pourrait appeler à l'aide les forces canadiennes?
Oh, écoutez, aujourd'hui, nous avons 48 gens avec COVID-19 dans les soins intensifs. C'est le chiffre le plus bas depuis le mois d'août. Si vous voyez la situation en Europe et en Afrique, vous voyez une situation semblable où il y a effectivement une diminution importante de pression relative sur les hôpitaux en ce qui concerne le soin intensif. Mais évidemment, il y aura une croissance de pression sur les autres fonctions des hôpitaux et on va travailler de près avec Alberta Health Services pour s'assurer qu'ils ont toutes les ressources possibles pour s'adresser à ce nouveau défi. Je dirais que nous prendrons l'action supplémentaire si c'est nécessaire pour protéger le système de santé. Mais le truc le plus important, évidemment, c'est pour les gens d'obtenir leur troisième vaccination. Ça, c'est le truc le plus puissant. Nous le voyons dans les autres pays et juridictions avec les vagues d'Omicron plus tôt, qu'il y a presque personne hospitalisé avec une troisième vaccination. Alors, ça, c'est l'essentiel. Et deuxièmement, nous soulignons l'importance pour les gens à suivre les restrictions qui existent déjà, qui sont assez rigoureuses en Alberta. Nous appelons, nous faisons un appel important auprès de la population à couper en moitié le nombre de leurs contacts interpersonnels avec les autres. En bout de ligne, ça serait les décisions de plus de 4 millions d'Albertains volontaires à réduire le contact qui puisse retarder l'épanouissement de Omicron.
Do you have a follow-up, Charlotte?
Yes, thanks. Monsieur Kenney, aussi, si les enfants retournent à l'école en personne lundi prochain, est-ce qu'on va aussi faire en sorte ou s'assurer qu'il y a une bonne ventilation dans les écoles, mais aussi penser à imposer de meilleurs masques comme le N95 pour tous les enfants, comme le demandent d'ailleurs certains médecins?
Écoutez, nous avons acheté 1 million de masques médicaux pour donner à chaque élèves et personnel dans les écoles et également les tests rapides pour tous les élèves dans notre système scolaire. J'ai demandé auprès de Dr. Hinshaw et nos experts s'il faut acheter les N95 pour ces gens-là, des N95s. Mais le conseil que j'ai reçu était qu'il n'était pas pratique ni nécessaire que les masques médicaux conventionnels sont très effectifs pour diminuer la transmission et que les masques N95 sont vraiment pour un contexte particulier dans les hôpitaux. And actually, Dr. Hinshaw, if I could ask you, I'll just translate the question, was about whether we should be using N95s in schools with the students. And I tried imperfectly to summarize in French the technical advice you've given us, suggesting that the medical grade masks provide a high level of protection, and that the N95s are much more appropriate for a hospital medical setting. Could you comment a little bit more on the sort of advice you've given us in that respect?
Thanks, Premier, and apologies that I'm not able to share this answer in French, but I have had extensive conversations with colleagues, both in the medical system and in public health, and there is very little evidence to suggest that in a community setting, using N95 masks is going to provide a significant additional benefit to wearing a well-fitted, high-quality medical mask, which is what's being provided. There have been countries that have attempted to use universal N95 masking. It has not changed the trajectory of transmission. N95 masks are appropriate in occupational settings. However, in the general public, including in places like a school, the challenges of wearing a tightly fit mask and the discomfort and some of the issues that happen when wearing those for prolonged periods of time, those challenges are not trumped by the any theoretical potential incremental benefit. Again, there's minimal evidence from the community setting that using an N95 in those settings will provide significant additional benefit to, again, those well-fitting, very high-quality medical masks that are being provided.
And I just want to underscore, if, look, the N95s are a lot more expensive. They're about, I think, $3.25 a piece versus about 80, 90 cents a piece for the medical grade masks. But we'd be prepared to spend that if the advice we had, if the data supported this as being a meaningful improvement in terms of protection. But the advice we've received, you just heard from Dr. Hinshaw, is that that conventional masks can be very effective, and that it's very unlikely that people will be properly fitted in a community setting to wear the more uncomfortable N95s. And so we think this is a much more practical solution to the problem that we're providing every student with these masks.
Thank you, Premier and Dr. Hinshaw. That concludes our media availability for today.
Thank you.